really 3 steps. And if we don't check the boxes here to look at the immune system, right, to look at the gut, to look at the nutrition, well, man, we haven't even prepared the body to heal. So now we get caught up in that symptom-based treatment. So, wow, your gut's not functioning well, what happens? Well, you have GI distress, so you get put on a proton pump inhibitor, the stomach acid pills, right? Or you can't move your bowels regularly, so you get them, put on medications to help promote bowel motility. But if we create balance again, the bowel's going to function as it's supposed to, right? So again, tougher thing to do because we got to look at the right tests. But once we have the information, the process is very simple. We just follow where it directs us. So again, the process is going to be individual for that patient. The tests allow us to really look at the specifics, really be individual rather than guessing, and then we can map out a strategy. Getting the systems back online here allows the body to heal. So as we bring these systems back in, we're going to start to impact all these other systems that it's interconnected to. Because again, that's what our body is, this interconnection of multiple systems, and one is going to impact the other. We don't work in isolation. So if the GI system is failing, or the immune system is failing, or nutritionally we're depleted, it's going to have a fallout effect on all these other systems in the body. So again, walking this patient through that, that's what we would do for them. Figure out the specific nutrition they need, the things in their environment that could be setting off the body, right? Those sensitivities, those allergies, to things in their environment, whether it's food, whether it's chemicals. Again, we have a lot of things in our houses. Now, if you look at the labels, many of them are really foreign looking, right? And your body is going to see that as foreign. So it's going to incite this autoimmune potential to cause more inflammation in the body. If that's known, then we're aware of it, right? We can see what we need to do. We can take the steps each day. We can clean up our house. We can clean up that environment. We can clean up our food environment. We get our mindset in the right place. We add the right nutrition. We have the diagnostics, so we're no longer guessing about what's going on, but we've tested out specifically for this patient. Now we can map out that plan where we can get them over here to a state where they're feeling well again. So now we're getting our energy back, right? We're getting our mental clarity back. We're getting that focus back that we didn't have before. Digestion is working normally. We're sleeping better. All good things. And then we can optimize that person over time by, again, maybe revisiting some of this testing depending on what it shows, because, again, if we want to implement a strategy, we want to make sure that we are correcting these symptoms that the patient presents with by correcting the system. So sometimes we'll revisit a little bit of this further out, maybe 3 to 6 months out, to do a recheck, because again, the environment is always changing. We are not a static operating system where it's very black and white. So our immune system's constantly evolving based on the threats around us. Our nutritional needs are always shifting depending on what we're doing, what is our overall state of health. So there is going to be some retesting to keep people optimal, and we may look at this every 6 months. And people say, well, wow, that's frequent. Well, we may not have to do that, but I think people take their cars in for oil changes and service more frequent than 6 months, right? So if we're not able to set our body at a higher level than maybe the maintenance we do for our car, well, then we may have some real problems and have to focus on ourselves a little bit there, but video for another day. So we may look out here, but we want to set up this framework so we get the body in this healing state over 3 to 6 months. We can start to get traction. That person's going to start on that journey down here at the foothills, and they're going to work themselves up to eventually that summit where they want to be. They're going to recapture that health. They're going to recapture that vitality. And that's how we would walk somebody through, say, something that isn't a pain condition in the practice, but again, the same framework is utilized for them. So thanks again for watching this video. Check out the other videos we posted below on the channel that's going to walk people through various conditions, some of them that we've already focused on, including arthritic needs and other joint and back pain type presentations. So again, this is Dr. Tait, functional medicine and regenerative medicine specialist here in Tucson, Arizona. See you next time.